Hi, my name is Corinne, and we are here today with Dr. Pfister to talk about Invisalign. It is the new way to do
Straighten
ortho.
teeth, yes. And what's really nice about it, Corinne, is that in traditional ortho, you have all the brackets and wires and everything on top of the teeth, which can be a little uncomfortable. It's something you have to put up with, and it makes it a little bit difficult to clean your teeth also. But now, with the advent of Invisalign, we have these trays. You can see how thick they are. They're very thin.
Yeah, they are very thin.
Very thin, so thin that really if you place them over top of the teeth, it really looks like you can't even see them. That's why they call it the invisible alternative, Invisalign, the invisible alternative to braces. And what happens is each one of these trays is changed by the patient. You get a new tray every 2 weeks. So every 2 weeks, there's a slight movement, and that is incorporated within the tray. And there's some things that we do chairside also from Invisalign that they request from us, something we call slenderizing, or where we take tenths of a millimeter of interproximal enamel, which is so small and minute that the tray then is able to make those changes even a little quicker. So traditional braces may last up to 2 years. Sometimes some kids have them on for 4 years. The Invisalign appliance, it can take up to maybe as fast as 9 months. Maybe in a more difficult case, maybe 18 months, but very rarely longer than that. And some cases even 6 months. So it just depends on what you want to have accomplished. And so there's other things we could talk about also, which is the clean check, which is something which is really neat, given by Invisalign. When we do a case 2, we take our records and we propose what we would like to accomplish in our treatment plan for the patient, and then we send that to Invisalign. They send us back a clean check, which is basically a simulation of how the teeth will move in each stage of each tray. So by the end of the treatment, you can see actually how your teeth would look.
Yep, the
So
before and the after.
The before and after.
Awesome.
So it's really a really cool way of the patient to really get psyched about and motivated to say, wow, this is what I'm going to accomplish, and so I'm really going to wear these trays. The downside of it is that it is a cooperation. There is a certain amount of, excuse me, compliance needed with this, because you can take the trays off. Now, they're adults, that's usually not a problem, but if we have a very committed young individual, someone who's older than the age of 12, that understands and is willing to make that commitment, and we get that commitment from them when we're doing our interview and our consultation, it's usually not a problem. These trays have to stay on for them to be effective about 23, 22 per day, hours per day. So you have some time, maybe a half hour, an hour here or there, to have your breakfast, lunch, and dinner. It's a really wonderful appliance, and folks should very much consider it. And if you want more information about it, you can go to our website, aestheticalorlarts.net, and there will be more information on there about us. Or you can call our office and make an appointment.